Welcome to the PCOS Society of India. As a founder president of the organization, I welcome you all to be part of our organization, which is a multidisciplinary organization consisting of specialists and experts from various fields of medicine who look after women with PCOS and even young girls and even children. Our organization is focused on education of the doctors and education of our patients. With the recent Vijayata program, which we have created through the support of Philips India, we are reaching out to women all over the country. And I request all of you to be part of this program, to take this complete agenda nationally and to educate our women on how they can prevent complications for themselves in future. I also request you to become our members, because that is what is going to help you in updating your skills in this field, which is really a very growing area of treating women and preventing problems in future. Thank you very much, all of you who have been with us, and I look forward to interacting with you in many, many more programs to come.
Good evening, everyone. I, Dr. Priyanka, on behalf of PCOS Society of India and Team Vijayata the Winner Project, I welcome you all for today's panel discussion webinar, which is on cosmetic concerns in PCOS. In today's webinar, we are going to discuss and understand the various cosmetic issues adult and adolescent face during their PCOS journey. So stay tuned till the end of the panel discussion, because here is your chance. If you have any questions, we are going to address this question and answers towards the end. So this panel discussion is being conducted under Vijayata the Winner project, where we are trying to conquer the PCOS through an outreach program which is conducted by the PCOS Society of India and is supported by Philips. Next. So before we start with the panel discussion, let us start by understanding what is PCOS. PCOS is a short form for polycystic ovarian syndrome. It is becoming increasingly common, with 1 in every 5 Indian women suffering from PCOS. It can occur at any age after the onset of menstruation. However, the majority of women are diagnosed between the age of 20 and 30 years. It is also the most frequently observed cause of female infertility. So coming back to today's panel discussion, we have with us Dr. Payal Bhargava, who is going to moderate today's panel discussion. Let me introduce Dr. Payal Bhargava. She is a consultant in Hyderabad, Eastern Hyderabad, practicing in Continental Hospital, Vivekananda Hospital, and Pranada Hospital. She has completed a postgraduate diploma in Artificial Reproductive Technologies, Reproductive Medicine from Kiel, Germany. She has fellowship in infertility, IMA Hyderabad. She has completed a comprehensive critical care course from Critical Care Foundation, Jaipur. She's a member of Foxy Oncology Committee, executive member of Hyderabad Menopause Society and PCOS Society India, life member of IMA Hyderabad. She's a co-founder and director on board XPS Analytics Private Limited. She's a co-founder of Divine Magic Foundation, which is a non-profit entity for public health initiatives and medical education programs for health professionals through digital channels. Her special interest includes menopause, infertility, PCOS, and cervical cancer. Let me introduce today's panelists. Today we have Dr. Ambuja ma'am, who's a very senior gynecologist. She's the president of Indian Health Society from 2021 to 2022. She has been the research committee chairperson of SAFONS from 2021 to 2023. She's a retired professor and HOD, Institute of Obstetrician and Gynecology from Osmania Medical College, Hyderabad. She has been a visiting professor in Savitha University, Chennai from 2019 onwards. She has been All India Vice President, Family Planning Association of India. She has been the faculty and the resource person for National Board of Examinations from year 2001 onwards till date. She has been the treasurer for Society for Obstetrics Medicine India. She's been the peer reviewer of Journal of OBGYN India, GMH, that is Journal of Midlife Health, Best Journal of Science. She's also been the consultant editor of JK Science, Journal of Medical Education and Research, and she has also been the UG and the PG examiner to various medical universities. Next, we have a doctor, senior doctor, Dr. Meghna, Phiske. She is a dermatologist. She has been an associate professor, Department of Dermatology in MGM Medical College in Mumbai since 3 years and plus. She has held positions like associate professor and assistant professor in LTM Medical College, LTM General Hospital, Science Mumbai for about 15 years. She has also been an associate professor at TNMC and Payal Hospital, Mumbai for 2 years. Her achievements include she has received Dr. V.N. Sehgal Award for Excellence in Dermatology. She has received various fellowships, scholarships, awards, grants to attend international conferences. She has published papers in journals, authored chapters and books, delivered guest lectures at various national and regional conferences. She has received prizes for papers and posters at various national conferences. She has been a reviewer for national journals on detailed. She has been the IADL Academy member, Sikh Dermatology Coordinator from 2022 to 2023. Next, we have with us Dr. Hema ma'am. She's a cosmetic dermatologist based in Northern expertise in the field. She has established a sunshine, skin and laser skin clinic in Madurai. Her academic achievements include scientific dissertation at the University of Wales College of Medicine. She is featured in numerous magazines and TV channels for her qualifications quality of work. She holds a certificate in hospital management from IIM Ahmedabad and IIM Bangalore. She has not only attended several workshops but also conducted workshops at lasers and conferences. She has delivered guest lectures and presented papers and talks. Over the past decade, she has successfully managed Devadoss Multispeciality Hospital. Her latest ventures include www.cureka.com, which is an online health shop, and the development of the telemedicine app Second Opinion 24 and the Widget Health Solutions Private Limited, where she serves as managing director. So once again, I welcome all the panelists. I would now request Dr. Bhargava to take over and start today's discussion. Over to you, ma'am.
Thank you, Priyanka. And I welcome all for today's session on dermatology problems in PCOS. Now, we live in a world where the spotlight is on us, whether we like it or not. Technology helps us communicate instantly. Social media helps to share our experiences and puts the spotlight on us. There is an underlying immense stress in today's society to be at looking the best version of ourselves. Whether it is our skin, complexion, or hair, we want all of them to be perfect and look the best. This is driving the rapid growth in hair care, skin care, and other cosmetic products. However, while all of these may help, it is said appearances are deceptive. Many times, similar is the case with symptoms and their root causes. So today we are going to discuss on PCOS and its dermatological problems. My first question is for Dr. Ambuja ma'am. So what are the common dermatology conditions in PCOS, ma'am?
Thank you, Payal, for including me in this discussion. I'm so happy to be, you are to be my moderator, and I'm going to answer your questions. Really bless you very much. Coming to the dermatological problems, first and foremost, what they are concerned is the excess hair growth in unwanted places. No girl wants excess hair, like on the face, like mustache, or like hirsutism and all that. They don't want on the legs and chest, because nowadays children, they wear all the short things. They don't want it to be exposed, and then getting all these things is a problem. And second thing they are bothered is about the acne. Suddenly one day one acne will come and they will come running. What is happening to me? So that's another problem. Instead of just one case like a beauty spot, but so many acne will crop up on the face and when chest, back, and all. So that is again another problem. And more than anything, the hair will come where you don't want, and it will fall away where you want. Like baldness. You don't want, you want plenty of hair at that time to show off, but that is not there. The falling hair is different. Recession of the hairline will be there. Then, and seborrhea is another one. They'll sweat like anything, and If they don't take bath 2 or 3 times a day, the minute you go to them, they smell. So that's another headache for them. And more than that, obesity is another problem. Obesity leading to the acanthosis nigricans. I'll explain you what is this acanthosis nigricans. Like all the skin around the neck, it will become velvety black. Whatever chain they wear, they think because of the chain, the skin has become velvety. But it is not the thing. It is because they are fatty and because of the insulin resistance, they have become like that. And like the axilla and wherever the skin folds are present, like below the breasts and all, this becomes a skin. These are the maximum skin problems which they come across, which they come to us.
Okay, thank you, ma'am. So, Dr. Meghna, why does hair fall occurs in PCOS patients, and why do they have hair, as Dr. Ambuja said, on upper lip and chin areas? Can you explain?
So now in PCOS, what happens? The main problem is hyperandrogenism. And because of hyperandrogenism, what happens is there will be raised levels of 5-alpha reductase enzyme. And what this does is it will lead to short anagen phase. Anagen phase is a growing phase of hair. When the anagen phase is shortened, it leads to miniaturization of the hair, and then you start getting baldness, as Dr. Madam has said. You start getting baldness. It is a very typical pattern of hair balding, which is different in females and males. In the females, there'll be the widening of the hair parting, and adjacent to the hair parting, the hair will start becoming sparse, but the hairline never goes back. It is usually maintained. But now, of late, we do see bitemporal recession, which is a typical male pattern hair loss, which is seen. And this all leads to a very lot of cosmetic concern for the lady. But what we need to understand and what we need to tell them is, even if there is balding, even if there is whitening of the hair parting, it is very, very less times that the entire hair on this portion goes away. Very, very less. If I see 100 patients, maybe 1 or 2 patients will have complete sparseness. So they did not worry about it.
So how do we treat this condition? Is there anything we can do to prevent this hair fall?
Prevention is, of course, you have to see when I see a lady with PCOS or a suspected PCOS, I will first ask her for acne. I will check for acanthosis. I will check for the widening of the hair parting. And then we have to, based on that, we do a simple test that we do in the OPD. That is a hair pull test, where we grab around 40 to 60 hair between the thumb and the index finger. We pull it. If there is no hair coming in between the thumb and the finger, it is considered to be AGA or female pattern hair loss, which is seen in PCOS. If we see some hair coming out, it is telogen effluent, which is a short-term hair loss, which occurs because of stress, because of major medical illnesses or surgery. So if the pull test is negative, it is usually considered to be a female pattern hair loss. If it is very mild, early stage, we may just give them hair supplements. Usually hair supplements having biotin, 10 milligram is commonly given. If it is a little more grade, we have to go for minoxidil. Minoxidil, once you start minoxidil, you have to give it more or less lifelong, because its hair is a growing phase and you need minoxidil for the continuous growth of the hair. And sometimes, if it is really very bad, we have to go for surgical procedures like platelet-rich plasma, derma roller procedures. We can have a combination of derma roller with platelet-rich plasma. But usually, and other options are there like spironolactone, but that is not required for very many patients. Only few patients require it. A good hair supplements with biotin, minoxidil, healthy lifestyle changes, exercise, avoiding stress, all that is sufficient. And most of the ladies do have their hair growth back.
Okay. So for how long do they have to take? Because most of my patients, they lose,
that is another big question. Yeah, that is another big question. If you start something like minoxidil, as I said, It depends on the grade. If it is a very mild parting, you can just give hair supplement, you can give hair serum. There are multiple hair serums available. But if it is a little more wider parting with a sparsity of hair here, you have to give minoxidil, and minoxidil has to be given lifelong. You can have a combination of finasteride, which can be given in a dose of 5 milligrams, and combination of finasteride and minoxidil, or you can give dutasteride, which is better now with a lesser side effects. But as I said, you have to tell the patient it has to be taken more or less lifelong. You can give it for maybe for a year or so. You give a small gap, then restart. That can be done, but usually it is lifelong.
Okay, and what is the age, ma'am? Because PCOD patients now, it's starting at a very young age, like around when they are in the 10th standard or 12th standard. So do we really need to give them these kids?
See what?
Payal, just I want to tell.
Yeah.
Yes, yeah, ma'am, please.
Yeah, Meghna, very good explanation what you have given. I do agree with you. But when the patient comes to me, to the gynecologist, what I say is it is a relative increase in the testosterone that is there. So we need to correct that, because it's not a single disease that is there, it is a syndromic approach. So that correction of that is more important than going to all these things. Biotin, up to biotin is okay, but taking minoxidil for lifelong is little cumbersome for anybody. If it is my daughter, I don't know, I think 10 times before going for that medicine. So before that, what is more important is, it is not the testosterone only that is increased, it is the ratio of testosterone to estrogens and progesterones. And here progesterone is completely absent. And estrogen is also at a higher level. So the first and foremost, what I try is giving the OC pills, that is the oral contraceptive pills containing both estrogens and progesterones for 6 months. And then this is a lifestyle disease, most of it nowadays. And I'll ask them to go for the lifestyle modification. And then only, I think regarding that question she will ask, but then only I will think of going for other lifelong medicines. What do you say, Meghna?
Yeah, madam, it is, I know it is not very practical, but if you start minoxidil, it has to be given lifelong.
Yeah,
there is no,
we got that into mind because of
this. And of course,
no, ma'am, but if we stop the minoxidil, then the hair loss is much more. Then they come back running to you saying that hair has started falling drastically. So that has to be sustained. So if the patient doesn't agree to continue with minoxidil, or they have problems continuing with the minoxidil, then usually we try some biomimetics also, which nowadays the Redensil and all is there, which is also helpful. Many people try to take it. Might not be as effective as minoxidil, but nevertheless it helps to a certain extent. So we do give biomimetics also.
Actually, the best combination is finasteride with minoxidil. That is the best combination. It is the most
effective one, actually.
That is what, madam, what I am saying is, all patients may not need it. You just tell them a healthy lifestyle, exercise, adequate sleep. I always tell them to sleep for 8 to 10 hours, drink lots of water. And stress is one thing. I have seen, ladies 21 years old, 22 years old, they are in good jobs and they have a lot of deadlines. All my patients of hair loss, all of them have this stress factor. So that has to be addressed. We have to tell them to take care of the stress, because stress induces everything. It induces, like, all changes are can be attributed to stress. One more thing that I also add is vitamin D, because it is found that vitamin D deficiency is very common in Indians. So I do give vitamin D to all my patients. It is not weekly, it is once a month. I tell them to take it once a month lifelong, because vitamin D deficiency has been proved to play a role in female pattern hair loss.
Okay. So does nutrition and, applying oil, like some home remedies, because most of the parents, they'll come and say that, no, we don't want any medicine. So do these remedies help, ma'am, like applying oil and, they mix it with neem and like something like that? And then they say like providing them good nutrition, like because hair fall, they say it can be because of anemia or thyroid or other issues. So do we do we give them a nutrition advice or some nutrition supplement which is natural, and applying and changing the shampoo or something like that? Does that really help? Because that's what most of the patients ask.
See, if it is a nutrition, definitely plays a big role. If you see vegetarians, they are deficient in B12, B6. If it is if they require zinc, and as you said, patients who are anemic, they require iron supplements. Nutrition does play a very big role. As I said, most of these girls are working. They have irregular working hours. They have irregular eating habits. They hardly eat proper. So nutrition, I tell them, yes, you have to eat nutrition properly. It can be your normal diet, but which is full of fruits, vegetables, nuts, sprouts, including fish, eggs. Meat, yes, you can take meat, but then it can lead to weight gain. So it can be a small portion, maybe once in a day. It should not be a very big portion. And that is the most important thing. Oils, yes. Regarding the oils, what I have learned is the coconut oil is one oil which has been studied and proved to actually go inside the hair roots and act. It is basically it is not the oil that is working. When you massage with the oil, you are actually increasing the blood supply to the scalp. That works. And of course, applying oil, if somebody is applying it for you, your mother is applying, somebody is applying, there is a placebo effect that also adds on to the hair growth. So basically, it is a massage. It's increasing the hair, increasing the circulation of the scalp. That is more important rather than the oils.
And one more thing is the dryness of the hair.
Yeah.
Usually, nowadays children, they don't apply oil at all, and hair will become so dry and dry. So it will be like a brittle hair. So even with applying the oil, the dryness will come down. So we should tell them night always, like all the Carelites, what they do is night they will apply coconut oil, and morning they will take the head bath so that it is dry, and again they will apply in the nights. I think that's a very good formula. That's why they'll have long hair, all the Carelites mostly.
Yes, there is a proof that coconut oil, there is a scientific research paper saying that when you apply coconut oil, it builds up the keratinocyte cells in the hair, so that helps a lot. And so if you keep it for 8 hours, then it's the best thing to do.
Yeah.
So your theory really works well, and it is true. But at the same time, diet is also important. And this application, as ma'am said, there are some ingredients which do per se, not because of the massage, they do increase the blood circulation on the scalp just by the presence of those ingredients. So those kind of ingredients also do help in hair growth.
There is one more point that I would like to add here. See, in the old, when we were studying the tablet ketoconazole, that is an antifungal tablet, it was given for female pattern and mainly female pattern hair loss. But now it is banned. It is not used because it causes a lot of liver toxicity. So what I do, or what is recommended, is you give a ketoconazole based shampoo, any shampoo which is ketoconazole based. You tell the patient to apply it every 15 days. So there are two advantages. One is it keeps the dandruff under check, because dandruff is a major cause for hair fall. And secondary, ketoconazole itself, it goes inside the hair follicles and allows hair growth. So that is also what I advise. Antifungal ketoconazole based shampoo to be used once in 15 days.
Even I give my patients, works well.
Okay. So, Dr. Hema, can you just brief us and let our audience know what is your message for beautiful, strong, and shiny hair? PCOS patients.
Well, one more thing, when ma'am said
the best we can do for them.
Okay, dry hair. When she said dry hair is very brittle, we always consider dry hair to be and brittle hair to be less in protein. So a protein-rich diet is mandatory. And of course, you can apply all your hair oils and everything. But everybody believes that changing of a shampoo or application of something is going to make your hair grow. But I think ma'am will also agree, Meghna ma'am will also agree that internally if you're fit and your health is fine, then only you have glowing hair. So for that, you have to have a good diet, a healthy lifestyle. As ma'am said, you have to sleep well and you have to eat on time. That is one more thing people do, they just skip times and then they don't eat on time. So all those things also adds up to your GI system being bad. So if you have a bad gut, again, hair loss will be there. So make sure that you're maintaining all this well. And apart from that, if you have a problem, yes, you should rush to a dermatologist and take help, especially if you have polycystic ovary syndrome. And if you have means symptomatically you're having issues and you're having the typical Christmas, tree pattern of hair loss, then you should approach the dermatologist and take help.
One more thing I want to add is we should always do a thyroid testing. Thyroid testing and CBC is very important because thyroid per se doesn't give any symptoms, but it can lead to a lot of hair fall, dryness of hair, roughness of hair. So always try to always do a thyroid test along with a CBC.
Yeah, because PCOS and thyroid, they usually go hand in hand. If not now, sometime later, the issues they usually develop. So now coming to the next most common symptom of acne. So why do acne occurs in PCOS patients, and are they different from the normal puberty acne which comes during the time of periods, or it's the same? And how do we how do we treat them?
So what happens as we know there is androgen excess in PCOS. What androgen excess does it causes sebum production that causes abnormal deformation of follicular epithelial cells, and that results in formation of comedones. So comedone is a basic lesion of acne. It is the lesion from which the other lesions appear. So because of this androgen excess, you have development of comedones. If you see comedones in PCOS or acne in PCOS, it is very typical. The lesions will be larger. They will be commonly seen on the jawline. They will not resolve fast. They can be very severe. They can be persistent. Whatever treatment you do, they tend to be persistent. And as I said, we are seeing acne now coming at the age of 20, 30. I have seen a patient
very young
with acne at 50 years of age. And I feel that is all attributed to the sedentary lifestyle. People are just sitting, they are working on their computers, they are having junk food. That is actually increasing the incidence of acne.
And again, perimenopausal and menopausal thing.
Yeah.
Endocrinological things are the same. Like adolescent girl, there also estrogen will be there and progesterone is less. So relative increase, that is the ratio between the testosterone and other hormones is there. That's why a relative hyperandrogenism plays a part there. Again, the hair growth and acne. Sometimes, acne come at postmenopausal age also is only because of this. The difference between the more of testosterone that is there.
So do these acne leave marks, or they can be like, you can still have that clean skin after treatment? And what do we advise? Like, do they need to apply some lotion or change the nutrition? What exactly they need to do to, so that these acne don't leave?
Advisably, they should go for treatment as early as possible, because if they delay the treatment and they're not taking effective treatment, then that leaves scars. Otherwise, we can, if they come early, we can treat them quite well so that they don't scar much. That can be done. So it's not like every acne has to scar. But it depends, what we see is when the later on onset of acne, it prolongs for a longer period of time than the pubertal acne, which can be controlled quite early and it can be kept at bay. But if the hormonal acne sets in and then it's quite late, some people start with their problems only by 25 or 30. So when they start like that, it's quite an ongoing problem, and they have to keep a check and have a regular style of making sure that their skin is maintained well.
So does eating more of oily and spicy food, does it increase the acne?
Not directly. Directly it doesn't do, but yes. But when you tend to eat something which is very oily and very spicy, what happens is your gut is not feeling good. Then if you have a primary problem, then that can be exacerbated. But if you do not have the problem and then you're going to have pimples because of that, no, that doesn't happen.
Okay.
No, actually, if you see the foods, the foods which have high glycemic index,
Yes.
your foods
They
which are based
exasperate.
on maida, based on sugar, milk products, they are going to increase your insulin resistance. When your insulin resistance increases, you're going to get acne. Now it is said insulin resistance is the main thing for development of acne. And the treatment would be based upon, of course, you have to see. I always do a investigation which includes the basic hormonal profile. I always check for insulin resistance by doing fasting insulin, fasting sugar, and I always calculate a HOMA ratio. Of course, we have to check for clinical evidence of female pattern hair loss, acanthosis nigricans, acne. All this has to be checked. And the type of acne will be, the treatment will be based on whether it is a grade 1 acne, grade 2 acne, grade 3 acne, grade 4 acne. We don't treat grade 1 acne with isotretinoin. It has to be based on the grade. And if you see the grades, grade 1, grade 2 are pretty good. They don't leave behind scars, but grade 3, grade 4, they do leave behind scars. Of course, even grade 1 can have scarring or pigmentation because patients manipulate. They try to remove the comedones on their own.
Yeah.
They try to apply things on their face to get rid of the comedones. And in that process, they end up having scars and pigmentation.
Okay.
But even nodulocystic acne, if it is treated effectively, I don't think many scars will be there as it was previously, It's not happening nowadays because there are very effective treatments now for those kind of conditions also. Like we have so many things we can consider treating them without scarring.
Okay. So like once they are treated, so do they tend to these acne tend to recur and then again they have to take like treatment again and again, or is it just one
In
time?
some cases, yes, it does happen because in some cases, what happens is the hormones are not maintained regularly. Like they settle for some time and then they get it back again. As ma'am said, probably because of dietary changes, because of the changes in their life, or some other problems which has cropped up like stress or something really bothers them suddenly. Then yes, there is a recurrence. It's very common also, not very uncommon.
For, the pimples, you said so many medications are available. What are they? You said for pimples, so many medications are available.
Yeah, it is.
There are many things we can. Yeah,
it is usually a combination of clindamycin, benzoyl peroxide, and topical retinoids. When you go to grade 2, grade 3, you have to go for oral medications like doxycycline, minocycline. If it is a very severe acne, you have to go for isotretinoin.
Yes. But even with isotretinoin, what we tend to do is, like in my patients, if they have large nodulocystic acne, and if we just treat with isotretinoin, there is a chance that they could scar or there are some lumps remaining in the end, So when those cases come up, what we tend to do is we give them intralesional triamcinolone also, just a trickle of it here and there, and we settle that, calm that down. And then with the isotretinoin, they do pretty well. So they don't even scar. I've had patients who have had nodulocystic acne and done really well.
No, one more thing that is important is patients who have PCOS, they will have a premenstrual flare. That is quite common. The acne settles down, they are much better. Then they come back one fine day, they will say, my acne always flares during the periods. So there are options. You can give tablets, cetirizine, which can be given 5 to 7 days before the periods start, and you can continue it. It is known to reduce the flare that happens premenstrually, but I have not given it to anybody because cetirizine can be highly sedative. So,
not only that, lasers also help in grade 2 and up to grade 3 also they are helped quite a bit. So lasers also we can try for acne. Of course, we have to settle down the seborrhea and everything. And then if they need antibiotics, it has to be combined with quite a few things. So there are many permutations and combinations we can pick and choose and treat the patient so that we make sure that they don't scar. There are quite a lot of peels also available, which are quite helpful if we start them early. So they also don't allow the scarring to happen.
So,
acne treatment is always
advice to all the listeners, whoever is there. First and foremost is we should not wait until the flares up. Yeah. Before that, what they should do is frequent washing the face. with just...
No, ma'am.
Yeah, why
That's
not?
very unfair to say that you should wash your face very often, because many patients come. Yeah,
it is recommended that you wash your face only twice.
Twice a
But if
day.
you frequently wash it, you're going to remove the natural oils or the natural moisturizing factor that is there in the skin.
In PCOS, what usually, you know, when they go out and all, lot of atmospheric pollution and all, that's again a flare-up is a common cause for that one. So
no, ma'am, for that also you can just wash your face twice is more than enough. You shouldn't scrub it clean, because acne skin is very sensitive skin, and you have to handle
no scrubbing. It's just simple wash, not using even
the washing also is not mandatory that you wash it several times. No, that's totally not acceptable by dermatologists.
What I tell my patients, is
the skin specialist says that's the latest one. I do. I accept with you. That's washing the face only 2 times, but not scrubbing.
Yeah, scrubbing is not
allowing them to scrub the face. Just wash with ordinary soap, not alkaline.
No, ma'am. No. We won't agree. No, it's not. No.
What I tell
our moderator says?
What I tell my patients is wash your face with a salicylic acid based face wash, which takes care of the comedones, because these are the basic lesions. The remaining of the time, you wash your face with these face washes twice a day. That is more than enough. The other times, you can just splash your face with water and just pat dry. You need not scrub or you need not use a soap. That is what I tell my patients.
They can splash water and they can do that, but not wash like with a regular soap or anything. I wouldn't suggest that at all.
Splashing
because we see such patients do very badly, because what happens is their skin is very sore. When they come to you, then the skin is very flared up. So to calm down the skin itself takes some time then. So that is, we do not accept or agree to that.
Okay. When we come back from home, to home from outside, because of pollution, we need to at least wash our face.
Yeah, you can wash your face twice per day, right? Morning once, evening once, you can wash with
soap patting is an irritant for
a
these
gentle
patients.
Cleanser should help.
So, okay. So now coming to the next most common problem, that is darkening of skin, especially around the neck and underarms. So because most of them want to wear sleeveless, or the neck is the visible part, so thickening and darkening of the skin in that area. So what do we tell these people? Do all patients have skin darkening due to diabetes or metabolic syndrome or PCOS, or there can be other causes also?
The darkening of the skin, which is known as acanthosis, it is basically because of insulin resistance. That is the most important cause. What it is going to do is it will stimulate production of skin cells and melanin, which can lead to this hyperpigmentation. It's a very typical velvety hyperpigmentation that is seen on the sides of the neck, nape of the neck, axilla, antecubital fossa, popliteal fossa, knuckles, thighs, umbilicus also. So it's a very typical peculiar, and they say acanthosis nigricans and hirsutism, these are actually a very good markers for PCOS. If you see acanthosis and pimples, you have to suspect PCOS and investigate accordingly.
Okay. So what is the treatment for this? How can the skin come back to normal with treatment?
It comes back to normal. Definitely it comes back to normal. What I do is I always ask for the HOMA ratio, which is based on the fasting sugar and fasting insulin. If the ratio is more than 3, definitely you have to give metformin. Metformin is a wonderful drug. It works very nice. Metformin has an advantage. It is safe, except for few side effects like nausea, and it helps you reduce weight. That is very one important advantage. You can help when you're taking insulin, you exercise, your weight goes down. Apart from metformin, you can go for preparations like topical retinoids, which have to be applied at night. We can start with a concentration of 0.025%. And there are creams which are urea, lactic acid, glycolic acid based creams, which can be applied during the daytime. You can go for TCA pills, that is 15% TCA pills. But one drug that works is the best is metformin. You can give it along with combination of alpha lipoic acid. What you have to tell the patient is you may require it for at least continuously for a period of 6 months. And I have seen acanthosis melt away with metformin. It's a wonderful drug.
Okay. So, Ambuja ma'am, do you give metformin to all your PCOS patients?
You gave me chance, I'm happy. But we see acanthosis is a marker for insulin resistance.
Yes.
When there is acanthosis, I will not do this Hema and all. My first investigation is doing one hemoglobin, one blood sugar, fasting and post-lunch. Not random is absolutely useless one. And then one thyroid. After doing that, once it is normal, you can explain them that she is not a diabetic, but insulin resistance is there. The drug of choice is glyphosate or metformin. I'll start with the 250 milligrams 2 times a day directly. I don't do any Hema or never, because recently I read somewhere doing the insulin levels, fasting insulin is not going to solve the problem, and calculation and all. I know. Practically, in my setup, I won't do it. I will do only fasting and post-lunch sugar. And apart from asking them to reduce weight, metformin is the drug of choice. First, I will start with the 250 milligrams 2 times a day to be taken along with the food. And then after about 15 days, once she's okay with that one, I'll make it 3 times a day. And still, if she can tolerate this, make it as 500 milligrams 3 times a day. Actually, we should go up to 2000 milligrams. But for Indian thing, what I'm giving is 500 milligrams 3 times a day. As Meghna said, absolutely safe drug, nothing will happen. And one of the effect is it reduces the weight. Yes, I do agree for that. But what we should tell them is take along with the food. Don't take on empty stomach, because so many non-medical people are here, no? So for them, they should understand that we are not giving the metformin for diabetes. It is for insulin resistance in PCOS. This is the drug of choice. Should be taken along with the food. If it goes into their mind, I think our seminar will be a thing, that one, because many a times we talk to them for 1 hour. The next medical shop they will go, that fellow SLC failed, or somebody will be sitting, and the first question he asks is, are you diabetic? The minute he sees the prescription, then they'll forget about all these things. They'll stop taking the drug. So if the audience can take this into their mind, that is done.
Yeah, this is the most important point, ma'am, because they get very scared and the parents will say, no, my daughter doesn't have diabetes. Why are you writing a diabetic drug? So this is a very common problem. And then they will just stop taking it. So, Dr. Hema, what is your take on this? Like,
yeah, I do give that. Very rarely I give metformin, because what I found was a lot of patients who take metformin, eventually, especially if they're younger, then they become diabetics very early in life. And we're not able to withdraw the metformin whatsoever, because they go on, it has to be continued for 6 months is not enough, if you withdraw it and then they come back with something else. So then it becomes a continuous thing, and you're just pushing them to, become a diabetic. So at times we do use it along with endocrinologist or a diabetologist or a gynecologist, watching them very closely. Otherwise, I tend to give them a lot of topical treatments and to ask them to lose weight. Once they lose weight also, that helps a lot, especially when it comes to acanthosis nigricans. It's not mandatory that you have to push a metformin on them. So if they don't come around with all that and still they're resistant to all that, then we think about a metformin. So that's, as far as I'm concerned, I don't take it as a first line of treatment. So I start treatment with a lot of other things, because there's so many things available at the moment, to treat acanthosis nigricans. We can do a lot of
first choice, Hema. Lifestyle modification.
Yes, ma'am. Yes, ma'am. Especially if they're younger, ma'am. Older people, yes. Yeah. Younger people, lifestyle modification, some kind of exercise.
Not go away.
Yes.
Without giving metformin, because I think.
But even if you give metformin, ma'am, and you stop it, then they come back with it again. So we see the recurrences
usually, 6 months treatment is more than enough. They will become all right. And if they continue with their lifestyle, definitely they'll become all right.
Yeah.
That's that.
Because what we need to
2 kg weight, then you will become normal. So once they start reducing the weight, they'll continue that usually.
Yes.
They are benefited.
What we need to understand is it is not just the pigmentation, it is the insulin resistance.
Yeah.
Yes. And we need to treat the insulin resistance, for which the best drug is metformin. You can give symptomatic treatment like topical retinoids. They will take care of the color, they will take care of the reduction in the color. But unless you treat the insulin resistance, things are not going to improve.
Yeah, but in younger age, lifestyle modification also helps in a great way. So it's not mandatory that you have to push everybody with the metformin. Yes, there are cases where we give also, but we consider this also as one aspect.
Okay, so how do we treat this thin PCOS patients? Even they have this thickening of around the neck. So does lifestyle modification, does it help, and will it go away completely and they will have like clear skin in these folds instead of darkness? Is it possible?
It is possible, but thin PCOS are the most toughest cases to treat, because the minute they take metformin, they come with 101 complaints, and that doesn't suit them. They have this issue, that issue, and then they come up with new problems, So you're trying to treat one and then you end up with many more. So they are the toughest cases to treat. But nevertheless, yes, there are many other treatments also available, like topical applications and, lifestyle modification. In them also, dietary changes helps them a long way.
Okay. So for how much time do we have to apply these, local ointments or creams for this thickness to go away?
First, if you're starting with
6
months minimum, but then maintenance has to be done continuously. That would be lifelong. Otherwise, they get it back. It never happens that it goes away like magic and never comes back.
No, I don't think so. It is lifelong. Once you have corrected the insulin resistance, the acanthosis goes down. And if you tell them if you don't want that acanthosis to come back, you have to follow lifestyle modification. It really doesn't come back. So that has to be told to the patient. You have to follow dietary restriction. You have to exercise.
Yeah. So actually, I think they need to be counseled a lot regarding, having it's a very tedious disease and a very stressful disease to have.
Acanthosis also, no? One more thing that's important. Some of the foods, what they should take. Because many people, they like, if you tell about the foods, they don't want medicine. So, like pineapple and palak, that's a very good thing. And karela, that's also good. And copper, garlic, turmeric. These, they act as anti-inflammatory.
Yeah.
And it's good in combined. I'm not telling only these things are going to help, along with the lifestyle modification, along with the exercise, along with the diet. And this also, if you put forward, definitely it's going to.
But they have to maintain it all through and through.
Yeah.
With their diets and everything.
And one thing we should counsel, as Payal said, we should make them understand that PCOD is not going to go away.
Yes.
It is going to continue. Unless you do the lifestyle changes, it is going to continue in your food. The minute you say there is a problem with the fertility, yes, definitely everybody will agree.
Yeah.
So, things.
Yeah, so Ambuja, for my patients, what I do, I've made a book called as Self-Management Guide of PCOS. So that includes what they have to eat and the time. It has a little bit of intermittent fasting, not much. And then we supplement it with, nutritional products to the patients. So that really helps. But then the moment they go back to their original lifestyle of drinking, smoking, and working late nights in office because of working in call centers, their timing is absolutely reverse of what the natural cycle is of the hormones. So they come back again. So it is very tedious.
IVF centers are coming. Do whatever it is, they don't reduce weight or don't do any lifestyles. Definitely it is.
No, but I've seen cases where they try their best and then they are put with a dietitian, they are on exercises and everything, and then they don't reduce weight. In those cases, we have to give them only metformin, and that's the only thing which works. So that also is there.
Yeah, that
so you can't blame them totally.
But we can't wait for a long time. Definitely, because acanthosis nigricans is a biological indicator for insulin resistance.
That's true, ma'am.
To reduce that one, you pimples and all, what are methods we can do it, Once the acanthosis is there, it is the metformin is the treatment.
So we have few questions here from our audience. So what can we do for excess hair growth in PCOS is one of the audience wants to know.
Excess hair growth means hirsutism. It is like presence of terminal hair in a male pattern distribution. That means you'll get a hair on the upper lip, on the chin. So you have to investigate it. Again, it is a marker for PCOS. You have to do the hormonal profile, look for insulin resistance, look for hyperandrogenism. And there are ways to remove it. There is a laser, that is Nd:YAG laser. Patient who can't afford, they can go for, other methods like, waxing or shaving. There is a cream called as eflornithine, which is very useful. What you need to do is you need to rub the cream on the upper lip and the chin. Rub it twice a day. So what it does, it will not cause the hair to stop growing. What it does, it will reduce the growth of hair. So you will have, if you're going to the parlor every 15 days for hair removal, you will go every 1 month. So that is a very useful cream. That is a very useful cream for reducing the hair growth. Patients who are actually very much bothered, they can go for laser removal. Nd:YAG laser is a good option. They can go for laser removal, but they say it is not a permanent solution. You have to go for the other things like lifestyle changes and all that.
Okay.
But with lifestyle changes and everything, eflornithine.
Eflornithine. It comes as Efflora. Trade name is Efflora. It's a very useful cream. The patient has to just rub it on the chin and the upper lip because that is the area where you see a lot of hair growth. You need to rub it and the growth reduces. There is a reduction in the hair growth. Meanwhile, you can go for other method. You can go for waxing. You can go for plucking, shaving. All that can be done because all patients cannot afford lasers. So these are the simple methods which one can do. But this eflornithine cream is a very good option for actually reducing the growth of hair.
Okay.
But it works only until you are applying the cream. So the minute you stop applying the cream, everything comes back. So you have to use it lifelong.
Yeah,
the best thing which in my practice, what I felt is the best thing works is laser, a good laser, that is, because many people use an intense pulse light and a laser for hair removal. That doesn't work much in these cases. It has to be a diode or an Nd:YAG laser which works, and it works quite well. The hair reduction is much better. But only thing what we see with hirsutism, especially with PCOS cases, is what happens is in them you have to keep doing it for quite some time. So they do it like at least once in 6 months, even later on in their lives. So it wouldn't be as much as which they started with, but eventually you see a good amount of hair reduction, and they do pretty well. Because what happens with waxing and threading in cases who have very thick hair is they tend to have pigmentary problems, then the hair is thicker, and then when you feel the skin, you don't feel it softer or smoother. That problem comes when they do all these other procedures. But with laser, that problem doesn't come. And one more thing is, if they have very thick hair, then the ingrowing hair also you are encouraging it by waxing it some more and doing other procedures. So with all that, I'm for laser hair removal kind of a
You're
thing.
right, but all patients
really
cannot afford, no?
But nowadays it's not very expensive, so it's not like it's not very expensive of late. So many people do opt for it, and it's a very neat and nice procedure. But until and unless you have a good chilling device along with a laser, otherwise people just jump in and say it's a laser, and then they produce a lot of heat, and that can scar the skin. So that's not acceptable. But if you use a proper laser, then the results are very good, and it's long term. Many a times you see at least 50% of hair which is permanently gone. The rest of it, yes, it is there, but combining with the other treatments and everything, as time goes by, they improve really well.
Okay. So, Dr. Ambuja, this question is for you, ma'am. My daughter is 12 and has just got her periods. She has a hair on her body, more on her hands and legs. Could she have PCOS? That is what one of the mother wants to know about her daughter.
Wait. We usually advise to wait.
See, the children, what they do at this period, nowadays schools, how it is, they don't have any place to play or anything like that.
Yes.
Directly open the door, they'll go and sit in the classes, and they'll come back and eat and sit and watch the cell phones for hours together, late night sleep. This is all the thing that's going on. First and foremost, the lifestyle is very, very important. Let mother ask her to get up at 5 o'clock, run, and reduce the weight. Give good food. That's very, very important. Good protein food and vegetables, fruits. These things are important. Not that they should cut short some junk food if they are eating, but along with that one, this also should be supplemented. With this, if it is not going to come down and any problem, they can go for all the methods what they told. But at this stage of life, I don't want to start with any hormones. Let them do lifestyle first, then only they will become all right. Of course, they may have some irregular periods or whatever it is, but still, this is the only treatment what we prescribe them. Even they don't need to go for hair removal at that period. What is there on the hands and legs? A 12 years girl, she is not going to participate in any of the fashion shows, no? And until she is 16 or 18, by that time she'll become all right.
Yeah, because HPO axis also takes time to settle and her periods will also slowly become regular. You don't need to treat her for anything. Just good diet and exercise.
Exercise. They don't do
And
exercise.
exercise, once you
Just
say
to
exercise,
play.
what
No
the mothers
exercise.
do is, they push their children to the gym. So gym is not the
Yeah.
only way to exercise. I mean,
Yes,
there are
to-
games
that.
available.
Yeah,
So
outdoor
they
playing.
say,
No gym, run.
So I keep telling the parents, please let your children play some games, you know,
Yeah.
where they love to do
Run,
it instead
run.
of pushing them to a gym where, you know, you're throttling them and taking them to a gym and putting them with a personal trainer
If you
and saying,
see-
now you
if
do
you
what he says.
Yeah.
If you see, the best form of exercise is brisk walking. All that you need is a good pair of shoes and an area to walk. The second good option is cycling. The third good option is swimming. If you can't do swimming, walking is the best exercise. That also brisk walking.
That's what I tell Meghna, play tennis or tennis. See, that is easy.
Yeah.
Walking means it's like old people. They don't like to walk.
They don't like to
So
walk.
if they are playing, they don't mind with their age children. They play for hour, 2 hours. And walking,
Even I
means
ask them
they
to
say
pick
it is
games.
old man's job. We don't want to walk and all. That will not work out. Only if you say that you play with your age group. And nowadays, you know, mummies are also not very old. So I tell them, you play with mummy. She's sitting at home, so play with them. That is a good option, what I say.
Okay, so the last question for the session today, what home remedies would you recommend to reduce acne, scarring and marks? That is what one of the
no
audience
home
wants to
remedy.
No
There is
home
no home
remedies for
remedy.
acne scarring.
You will worsen your scars. There
Yeah.
is no home remedy. It should be
Because
go to
usually
the
when they try
patient.
home remedy, they come with worse problems and worse
They should never
complications.
use.
Very difficult to handle them then.
No home remedies.
Yeah.
They have to go to a dermatologist
You
and
have to
take
advise
it.
them, don't pluck it.
Yes.
Yeah.
Don't pick it.
Very bad.
Press
And don't
it.
rub anything which comes
Yeah.
in your hand. A lot of people advise that you rub this on your face, rub this on the scar, and then they come with so much of pigmentation. So the pigmentation has to be handled, then the scar has to be handled. Oh my
One
God,
more
it
thing
becomes
they
very
should know
difficult.
is, if this acne is near the nose or near the eyebrows that is there, that has got a direct connection to the central nervous system.
Yeah.
So we have seen the patients where they have plucked it and they have ended with the convulsions and they have come to the emergency room.
Yeah, it is called dangerous area of
So
face.
it is a dangerous of area of face. We should tell them not to pluck under any circumstances, because so many people always their hand will be, once there is some growth, if their hands is there on this, try to keep the hand on the face. Try to avoid that one. That is a good message we should give to parents, mothers, and children also.
Thank you so much, all the panelists, for your views. I got to learn a lot, and it is really going to help all our people who have been watching this.
Yeah, Payal, I'm also very happy that I could see to my own student, I'm a panelist, so I'm very happy for that.
Thank you so much.
Yeah,
How we want to encourage youngsters.
Yes.
So,
Dr. Priyanka, are you there?
yes,
Yeah,
yes,
for vote
ma'am.
of thanks.
So, yeah. So
So we had a very in-depth discussion, I believe, on the cosmetic concerns in PCOS, and we discussed like all these common cosmetic issues which a PCOS patient may face, like excess hair growth, acne, darkening of skin, loss of hair on scalp. We discussed various factors that reverse these issues. What are the various diagnostic and treatment options and the remedies? So it was an in-depth discussions on behalf of PCOS Society of India. I thank all the panelists for taking your time out and giving your valuable inputs and advice for today's discussion. I believe it's going to be very useful for anyone who's suffering from these cosmetic issues. Thank you so much, Dr. Payal ma'am, Dr. Ambuja ma'am, Dr. Meghna ma'am, Dr. Hema ma'am. And also thank you for everyone who has joined for today's panel discussion. Also, this session has been brought to you by the PCOS Society of India. Special thanks to Dr. Dusha ma'am, Dr. Shobana Patel, Ms. Ruby Sound ma'am, and the team of Vijayata Project. If you have all the audience who has joined us, if you have any queries, please feel to contact us 915291921, or you can write us on manager.vijayata.pcos@gmail.com. So once again, thank you all the panelists. Thank you so much, and we can end today's discussion.
Thank you. Thank you.
Thank you.
Thank you so much.
Thank you.
Yeah.
Good night.